Welcome to Damal Consult Career Academy. In this video, we're covering the top 20 NHS maternity support worker interview questions and answers. Whether you're preparing for your first interview or looking to refine your responses, we've got you covered with detailed answers and tips to help you stand out. Let's dive in and make sure you're ready to impress in your maternity support worker interview. 1. Why do you want to work as a maternity support worker? I am deeply passionate about supporting expectant mothers and newborns during such a crucial time in their lives. The role of a maternity support worker allows me to combine my interest in healthcare with my desire to provide compassionate care. I find fulfillment in assisting families through the challenges of pregnancy and childbirth, and contributing to a positive and supportive environment in the maternity ward. 2. What experience do you have working with pregnant women or newborns? I have worked as a healthcare assistant in a maternity ward for 2 years, where I assisted with various tasks such as monitoring vital signs, helping with deliveries, and providing postnatal care. My responsibilities included supporting mothers with breastfeeding, offering guidance on newborn care, and ensuring a comfortable environment for both mothers and babies. Additionally, I completed a specialized training course in maternity care that covered essential aspects of this role. 3. How do you handle stressful situations in a maternity setting? In stressful situations, I focus on maintaining my composure and prioritizing tasks effectively. I break down the situation into manageable steps and address the most urgent needs first. Effective communication with colleagues is crucial, so I ensure to relay important information clearly and seek support when needed. I also practice stress management techniques, such as deep breathing and time management, to stay calm and focused. 4. Describe a time when you provided excellent patient care. During my time as a healthcare assistant, I cared for a new mother who was experiencing difficulty with breastfeeding. She was feeling overwhelmed and anxious. I took the time to listen to her concerns, provided hands-on support with breastfeeding techniques, and offered encouragement. I also connected her with a lactation consultant for additional guidance. This personalized approach helped her overcome the challenges and build confidence in breastfeeding, improving her overall experience. 5. How do you ensure confidentiality in your role? Ensuring confidentiality is a top priority. I strictly follow NHS guidelines on data protection and patient confidentiality. This includes securing patient records, avoiding discussions of patient information outside of authorized settings, and only sharing details with relevant healthcare professionals. I also make sure that any electronic records are protected with strong passwords, and that physical records are stored in secure locations. 6. What skills do you think are most important for a maternity support worker? Key skills for maternity communication, clearly convey and maintained empathy, understanding gaidenters, attention totidal, monitoring gandakuntim, patience, supporting patients, teamwork, collaborating fight care. 7. How do you support a patient who is anxious about childbirth? To support an anxious patient is start be active validation. I offer clear, accurate information. He also is a calming, sukis depriations, and providi metassal. If needed, involving midwiferyans or orzawes. 8. How do you work with other healthcare professionals in a maternity setting? Effective attendance twice a maternity sting. Yentropinandixful including midwives, nurses, and doctors. A participate in GSM care plan sad privation. Collaboration is unveils. In thorough less distantiary quality patient care. 9. What would you do if you noticed a change in a patient's condition? If an autistia change in a patient's condition, I will immediate I document thakajuthi including ganira vavation. I follow an istinstabin storing with an inus severate. 10. How do you stay updated with best practices in maternity care? Estaputa twistect. I read relevansal research articles and guidolins. Is sued by professingen. Additionally, engage in perticence Time corporate Hank 12 sunk practice. 11. How do you approach supporting a mother who is struggling with postnatal depression? Supporting a mother with postnatal depression involves a compassionate and sensitive approach. I start by actively listening to her concerns without judgment and validate her feelings. I provide information about available support resources, such as counseling and support groups. I also ensure she is aware of any professional help she can access through the NHS. My role includes offering practical support and encouragement while working closely with the healthcare team to monitor her well-being. 12. How would you handle a situation where a family member is not following medical advice for a newborn? In such situations, I would approach family member with empathy. Addressing thirsts, I would provide. If needed, I would involve essential. Ensuring that a theme. 13. Can you describe your experience with infant care, such as bathing and feeding? I have hands-on experience with various aspects of infant care, including bathing, feeding, and changing diapers. In my previous role, I regularly assisted with newborn care routines, ensuring that each task was performed safely and gently. I am familiar with proper techniques for bathing an infant, preparing and feeding formula or breast milk, and recognizing signs of discomfort or distress in a newborn. My approach always prioritizes the baby's comfort and safety. 14. How do you ensure that you follow infection control procedures in a maternity setting? I adhere to strict infection control procedures by following NHS protocols, such as hand hygiene, wearing appropriate personal protective equipment (PPE), and maintaining a clean environment. I ensure that all equipment and surfaces are disinfected regularly and that any contaminated materials are disposed of properly. I also stay updated on best practices and guidelines for infection control to prevent the spread of infections and protect both patients and staff. 15. What strategies do you use to communicate effectively with non-English speaking patients or families? To communicate effectively with non-English speaking patients or families, I use translation services or interpreter assistance when available. I also employ nonverbal communication techniques, such as using visual aids and gestures, to help convey important information. I make sure to speak slowly and clearly, and I am patient and attentive to ensure that the patient or family understands the information being shared. 16. How do you handle a situation where you have to deliver bad news to a patient or their family? Delivering bad news requires sensitivity and empathy. I prepare by ensuring I have all the relevant information and am clear on the facts. I choose a private and comfortable setting for the conversation. I present the news in a clear, straightforward manner, allowing time for the patient or family to process the information. I offer support and answer any questions they may have, and provide information on the next steps and available resources for additional help. 17. What do you think are the most important qualities for a maternity support worker to possess? The most important qualities for a maternity support worker include compassion, providing empathetic and understanding care to new mothers and their babies during a critical time, attention to detail, carefully monitoring and documenting patient needs and conditions to ensure accurate care, strong communication skills, effectively interacting with patients, families, and healthcare teams to provide clear information and support, patience, handling the various demands of the role with calm and consideration, especially when dealing with challenging situations, flexibility, adapting to changing circumstances and patient needs while maintaining high standards of care. 18. How do you handle situations where you have to work with minimal supervision? When working with RISM, Irilon mi abilitate, stay organized, and mac informatis, I follow establishment. I also maintain comink, providing updating. My goalisto manasmi car. 19. Describe a time when you had to adapt quickly to a change in patient care needs. I once worked with a patient who experienced a sudden complication that required immediate adjustments to their care plan. I quickly assessed the situation, communicated the change to the relevant healthcare professionals, and adapted the care approach accordingly. I ensured that all new instructions were followed precisely and kept the patient and their family informed about the changes. My ability to stay calm and responsive in such situations helped in providing effective care during the unexpected change. 20. How do you handle situations where you need to advocate for a patient's needs? Advocating for a patient's needs involves understanding their concerns and ensuring they receive the necessary care and support. I listen actively to the patient or their family and identify any unmet needs or issues. I then communicate these concerns to the appropriate healthcare professionals and ensure that the patient's needs are addressed. Advocacy also includes providing information and support to help patients navigate their care and make informed decisions. Thanks for watching. We hope these top 20 NHS maternity support worker interview questions and answers have equipped you with the insights and confidence you need. If you found this video helpful, please give it a thumbs up and subscribe to our channel for more career advice and interview preparation tips. Feel free to leave any questions or comments below, and good luck with your interview. See you next time.